Clinical guidelines play an integral role in all aspects of patient care. We assessed professional society-based clinical guidelines from 2012 to 2022. We found that 40% of guidelines do not follow all the recommendations made by the Institute of Medicine. In fact, there has been a significant increase in documents in cardiology, gastroenterology, and hematology-oncology professional societies. Out of more than 20,000 recommendations that have been published in this time period, there's been significant variability in recommendations made by various professional societies within a particular subspecialty. These data have important implications for healthcare, since guideline documents help in health policy issues like assessment of quality of care, medical liability, education, and payment. My name is Dr. Nikita Jhawar, and I'm currently an internal medicine resident physician at Mayo Clinic in Jacksonville, Florida. We recently published our manuscript titled Impact of Professional Society Guideline Publications in Medicine Subspecialties from 2012 to 2022. Implications for Clinical Care and Health Policy in Mayo Clinic Proceedings, Innovations, Quality, and Outcomes. We invite you to read our article in the journal. Clinical practice guidelines have become an important determinant for defining best care practices and have had a profound effect in medicine. The Institute of Medicine has certain recommendations on the development of clinical practice guidelines. They've issued reports emphasizing the importance of transparency for document development and writing group composition, managing relationships with industry, and articulating recommendations with an appropriate evidence base. In our study, we evaluated guideline documents and their recommendations for the largest subspecialties in internal medicine from 2012 to 2022. Each document was evaluated for transparency on methodology, conflicts of interest, class of recommendation, and level of evidence for those recommendations. Our results showed a notable increase in professional society guidelines over the past decade due to increases in cardiology, gastroenterology, and hem-onc documents. All documents that were studied provided an RWI disclosure, and about 59% had a clear methodology documented. Interestingly, for 6 out of 7 specialties and 13 out of 15 professional society documents, more than 45% of recommendations had a level of evidence C. And finally, within cardiology, there's been an increase in the number of non-guideline documents with clinical recommendations using standard guideline format. How do these findings relate to clinical practice? As our data show, the proliferation of both sets of guidelines presents a challenge to clinicians, partly in terms of how to stay up to date on the most current literature when there's an ongoing surge of document proliferation. And also with the increasing proportion of level of evidence C recommendations in the majority of professional society documents, this suggests lower quality evidence supporting those recommendations, which are intended to be applied in the clinical setting. In terms of how these findings influence patients, guideline documents are helpful to the clinician when considering diagnostic and treatment strategies for an individual patient. Non-guideline documents provide consensus advice from experts to support clinicians in treating conditions that remain understudied. The goal is to provide real-time, focused, and point-of-care guidance to help in individualistic patient care, as opposed to thorough reviews and large-scale trials. But again, the conflation of recommendations with limited evidence base can have unintended consequences for patients. In the future, we encourage collaborative and judicious production of guideline and non-guideline documents to curb the overwhelming proliferation and improve health policy outcomes. Thank you for your time.